Hello friends, welcome to our YouTube channel SLP Sanjay Kumar, voice therapist, and we are live here. And with us, Vinod is here, and Vinod is having some high pitched voice. We can say childish voice or feminine kind of voice. And I am Sanjay Kumar. By profession, I am speech language pathologist and audiologist, and I have done my graduation from AIIMS Delhi, also known as All Indian Institute of Medical Science, New Delhi, in the field of speech and hearing sciences. And I have done my post graduation from the University of Mysore in the field of speech language pathology. And my area of interest is treating voice disorder. So because of this corona pandemic, we are mainly giving online voice therapy. So Vinod, tell about your problem because we are live. So let people know what problem you are facing, and after therapy also will become again live.
Sure, doctor. Hello, all. My name is Vinod. I am 28 years old. I'm basically from Chennai and I'm currently working in UK. I'm currently suffering from this pitch voice in the past 10, 15 years. And sometimes I get too little voice and have to, to change the pitch. So different voice will be there, and it is basically very difficult for me to stay in place. In the workplace, it is basically very difficult. And moreover, if there is a crowd and if I wanted to like some points or put some of my opinion, it is basically very difficult, and it is keep on as age goes, it is reducing my confidence level. So I was searching online for
Okay, so tell your hobbies.
my hobbies are I used to watch TVs, Netflix, Amazon, yeah, Prime videos. So those are my hobbies. Yeah, that's it.
Yeah, since how long you are facing this problem?
I think for the past 10, 15 years, using this problem.
Yeah, so awareness is slightly less about this problem, when the feminine voice or high pitched voice occurs. So one reason can be the vocal cords are not vibrating effectively because during puberty, mass of the vocal cord, length of the vocal cord changes due to a hormone called testosterone. And so after puberty, the vocal cord mass will increase and length will increase. So the vocal cord will start behaving like, if you are comparing with a guitar string, it will start behaving like a thick string of the guitar. But before puberty, it will behave like a thin string of the guitar. So guitar string is thin, the pitch will be higher, the voice will be more shrill. But when the guitar string is thick, the pitch will be lower. So some kids, even after puberty, they will not accept the new voice, which is your vocal cord is ready to produce that voice sometime, but they will not able to shift to the new voice. So they will still using the childish voice or feminine kind of voice. So most of the cases, voice therapy is very effective. And some other reason also can be there in the feminine voice and high pitch voice, like nature has not given sufficient mass in the length of the vocal cord, so vocal cords will be thin. So even in that case also voice will look like a high pitch and all. So the problem we call sulcus vocalis. I have seen that sometime like untreated puberphonia or treating the voice disorder with some wrong technique and wrong way, the phonetry gap develop, and in that also creates the high pitch voice, and in some cases in the muscle tension dysphonia also I have seen the high pitch voice. So understanding the problem is very important. It's not like just voice therapy is a one simple medicine and give all the patient to the same thing. And for that, the expertise of the speech language pathologist is important. Sometime I am seeing in the social media and all, some healthcare quacks will be giving some exercise on the, and they will try to make video and they will read somewhere in the online. But taking suggestion from the like healthcare quacks sometimes damage the vocal cord. So whenever you are taking any suggestion, you should take from the professional. Those who are watching this live, I'm suggesting for those people. And how you know that who is a professional and who is a healthcare quack? So it's very simple. The healthcare quacks will never mention that which college, which university, which year they studied and what subjects they studied. They will also not mention if they are registered in the Rehabilitation Council of India or not. So you will not find any information. But those who are professionals, you will find all this information. So when you have a doubt, maybe your therapist will be the healthcare quacks or Jhola Chap doctor. especially for the speech therapy, then you can ask this question about, or you can try to explore this information from your therapist, like which college he has studied, which year he studied, and which university, Rehabilitation Council of India, he is registered or not. So if you'll just try to explore all this information, you can very easily filter who is a healthcare quacks on who are the real speech language pathologists and speech therapists. Because some healthcare quacks will also write at the social media they are a speech therapist. They will also mention their center as a speech therapy center. So sometimes innocent people will not able to understand who is the real professional and who is a healthcare quacks. And sometimes healthcare quacks will just see that what the therapists are doing and all, maybe some of their relatives, and sometimes they have gone to some therapist and they will try to catch few information and they will try to treat the patients. So it may damage sometime vocal cord and the voice. So you should be give respect to your voice and the vocal cord, and you should always take the help of the professional if you have a speech problem and a communication problem, and if you are planning to go for speech therapy or voice therapy. That is my suggestion. So those who have joined newly, I will tell, by profession, I'm a speech language pathologist and audiologist, and my area of interest is voice disorder. I have studied from AIIMS Delhi, All India Institute of Medical Science, New Delhi, in the field of speech and hearing science. I have done graduation from there, and I have done my post graduation in the field of speech language pathology from the University of Mysore. So now Vinod is here with us, and Vinod, yeah, tell about your problem. There may be some new people has joined, so let them hear your voice.
Yes, doctor. So basically, suffering from this pitch voice, and sometimes I used to get the dual voice also. So that is actually, making like suppose I'm in a meeting or I'm talking to many people in a crowd. It is
I think
making the situation
I think
more
some
complicated.
network issue. I'm not sure. Slightly, you can speak slowly. Some clarity is lagging. I should increase the volume. Let me check. Some clarity is
Okay,
lagging.
okay, doctor.
I'm not really able to increase. Okay, volume is fine, I think. Yeah, you can keep telling about your problem.
Yes, doctor. So that is what. So whenever like in a crowd, suppose gang of people, or because now currently I'm in a client place, uh, currently in UK. So sometimes we used to get so many meetings. So it is really very difficult for me to tell everything confidently. Even if points are correct, voice matters actually.
Yeah. So when
So
you talk on the phone, people say "madam" to you also sometimes.
yes, sometimes it is like 50-50. Sometimes I will sometimes try. Uh, if I'm speaking to someone, I will try to like speaking low pitch voice, but I'm not able to continue that voice. Again, it will by default it will change to high pitch. So I'm basically struggling how to keep
Okay,
things.
so just for awareness, I'll be trying to explain a little bit the cause, like which happens in the typical Puberphonia. I'm not talking about the, like as I told, there may be some issue of sulcus vocalis, there may be some phonatory gap, there may be muscle tension dysphonia, there may be some hormonal issues. So there are so many reasons, but when the vocal cords are normal, and if it is a case of typical Puberphonia, in that what happens, I'll be just trying to explain. To understand that, let's first understand how the normal speech production mechanism is. So that will give you an idea why this problem is. For normal speech production mechanism, first thing is the thoughts, and that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put a air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cord start moving like a string of a violin and guitar, and sounds will generate. And then we modify that sound into different sound with the help of our articulators. Like articulators are our lips, tongue, jaw, teeth, palate. For example, if you want to say "p," both the lips are coming closer together and touching each other. So "p" is a kind of bilabial sound. When you want to say "t," tongue is coming between the teeth. So "t" is a dental sound. So when you want to say "k," back up, the tongue is getting elevated and touching the soft palate. So it's an alveolar sound. So when you say a sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord moves, sound generate, we modify that sound into different sound with the help of our articulators. And in one sentence, there are so many words. In each word, there are so many sound. Each sound has own place, own manner of articulation. Like, and the speech production is a quite complex process. In this process, there are hundreds of our body muscles works in a coordinated way. If coordination among these muscles goes, fluency goes. So that will reflect in the form of stammering. So some people will they say "Kekka kaka kiran." So the coordination among the speech production muscle with the brain is not happening in that situation. And like some people will say for Ram, they will be saying Lam, for Kabutar, they will be saying Tabutar. So that is the articulation problem. So for each and every sound, we have the place of articulation, manner of articulation. So they are not putting their articulators at the right place. For example, if they want to say ta, tongue should come between the teeth. But if they are putting tongue somewhere else, the sound will be something different. So in the articulation therapy, just we try to teach the place of articulation and manner of articulation during the speech therapy. And for the stammering or stuttering, there is a lagging the speech production mechanism, means the lagging in the speech production muscles, I can say better. So we try to work on the coordination of those muscles which are involved in the speech production. And now let's most important your problem. In your problem, what is happening? Like during puberty, due to a hormone called testosterone, mass got changed, length got changed. Because before puberty, the vocal cord was like thin, and during puberty, because of the testosterone effect, mass of the vocal cord increase and the length of the vocal cord increase. So the pitch should reduce. The reason is that if you remember the acoustics, there is one formula, n is equal to 1 by 2L under root T by M. So the frequency is directly proportional to the tension, but inversely proportional to the mass and the length. So before puberty, the mass was less, length was less, the pitch was higher. But during puberty or after puberty, due to the testosterone effect, mass got increased, length got increased. Okay, so the pitch will reduce because frequency is inversely proportional to the mass and the length. Like in the acoustic, that formula is how the any string vibrates. Like n is equal to 1 by 2L under root T by M with this relation. So after seeing you, I'm seeing nice mustache, beard, and everything. Fine. So still, why the pitch is higher? I don't feel that maybe you're having any hormonal issues after seeing your even the face and the physically to you. Then why the pitch is higher? Because from childhood to puberty, you spoke in a high pitch voice. During puberty, mass got changed, length got changed. So now your pitch should be lower. But because of so many years childhood habit, you have not accepted the change which has happened during the puberty. So you may be having normal mass of the vocal cord, length of the vocal cord, okay, based on my examination, what I did earlier. So, but you are not using your whole mass and the whole length to vibrate. So you are using only thin edges of the vocal cord while vibration of the vocal cord when you're speaking. So only thin edges are vibrating. So what does it mean? That vocal cord is having the sufficient mass, sufficient length, but vibrating only thin edges. And when it is vibrating the thin edges, so vibrating mass will be less, vibrating length will be less. In that formula, you can correlate n is equal to 1 by 12 under root 2 T by M. So if vibrating mass will be less, vibrating length will be less, vocal cord is behaving like a thin string of a guitar, but actually it is a thick string. So when the vocal cord will behave like a thin string of the guitar, the pitch will be higher. So what I will do as a voice therapist, I will try to stimulate the whole mass and the whole length of the vocal cord. Like earlier it was vibrating only thin edges, but with the voice therapy or vocal exercise, I will stimulate whole mass and the whole length. So once whole mass and whole length will be stimulated, the pitch will reduce and slowly will reach to the conversation with the step by step. Okay, so this is the way how we work during the voice therapy. And I'm getting so many questions from the people. I will try to give the answer at least. And first I will say thank you everybody for joining. Manish, thank you. Joseph, thank you. Manish, Nani, everybody, thank you so much for joining and watching us. And Joseph is asking, is it possible to heal sulcus vocalis? So complete cure of sulcus vocalis by voice therapy is not there. And but as I told, the frequency is depending on the mass, length, and the tension of the vocal cord. So I can't change mass of the vocal cord, length of the vocal cord, but I can teach people to talk in a more relaxed way. So if I'm working on the tension, there will be slight improvement in case of the sulcus vocalis, but there will be no huge improvement. So I think I have given the answer of Joseph, and some people are asking about the treatment cost, and this is the very common question: treatment cost and duration, and this is most important question also. So different communication disorder will require different duration of treatment, and even the depending upon that the cost will also vary. So first I'll suggest the people who call us at our contact number is 918042041980 if you are outside India, and if you are from India, the contact number is 080420411980. We'll do the perceptual evaluation. मीन्स सबसे पहले हम लोग सुनने की कोशिश करेंगे आपकी आवाज़ को और समझने की कोशिश करेंगे. ज़रूरत पड़ेगी तो then we'll recommend some test also, and once we'll see the test findings and our perceptual evaluation will be done, then we will be able to comment on the about the more detail of the problem like duration and the cost. सो सबसे पहले हम लोग क्या करेंगे कि आपकी आवाज़ को हम सुनेंगे. अगर आपको कम्युनिकेशन प्रॉब्लम है तो हमारा कॉन्टैक्ट नंबर है 080420411980. अगर आप इंडिया से हैं तो इंडिया से बाहर हैं तो 918042041980 इस पर कॉल करें. हम आपकी आवाज़ को सुनेंगे, समझेंगे, फिर उसके अकॉर्डिंगली हम गाइड कर पाएंगे ड्यूरेशन और कॉस्ट के बारे में. क्योंकि समटाइम व्हाट हैपेंस द पेशेंट विल बी टेलिंग वेरी सिंपल, सर आई हैव द हॉर्स वॉइस, how much treatment cost will be there and what will be the duration. So for the hoarse voice, symptoms can be in so many conditions. Hoarse voice symptoms can be in so many situations. If somebody is having the vocal nodule, the voice will be hoarse. If somebody is having vocal polyp, voice will be hoarse. And even though somebody is having the cyst in the vocal cord, the voice will be hoarse. And even sometimes I have seen in the puberphonia also the voice will be hoarse. So even the muscle tension dysphonia, I have seen the sometimes voice will be hoarse. Even I have seen the spasmodic dysphonia, voice will be hoarse. So how can I say that in the hoarse voice, how much will be the treatment duration and treatment cost? In fact, in some time in the during the cough and cold also voice will be hoarse. Even during the vocal cord cancer also the voice will be hoarse. So just saying hoarse and how much treatment cost will be there and duration will be there, it's practically not possible. And so people, those who are having the communication problem, not all the people, some people I suggest after doing the perceptual evaluation for the laryngoscopy to some otolaryngologist or laryngologist, but not all the communication disorder. So I will be suggesting first they can call to us and then we'll listen the voice and then accordingly we can suggest what should be the next step. So thank you everybody for joining us. And some people are asking like last time also some people has commented like when the clinic will be starting. So at this moment we are giving online therapy session, so be in touch with our contact number, or you can mail us also. Our website detail is www.speechtherapyindia.in, and there you'll find our contact number, email ID, everything. And be in touch, we'll be informing when we are starting seeing the patient physically. At this moment we are seeing only online. So I was getting question from the Manish. So thank you Manish for asking this question. So thank you everyone for joining, and Vinod, you can tell about your problem once again so that people can listen your voice. So again we'll be live after therapy also.
Yes, sure. Sir. I'm 28 years old. I'm basically currently working. Okay. Yeah, suffering from this high pitch voice in the past 10, 15 years. So I was checking in online for any videos, tutorials, exercise, some other things, but no more luck actually. Then luckily I found your videos, and I've seen your pre and post videos for your most of your clients as well. It's really motivating actually, like seeing those videos. So I got some confidence that my voice also should be corrected. So that is what.
Okay, thank you so much, Vinod, for your faith on us, and thank you everyone again. I want to thank you everybody, those who have joined. Manish, thank you. Joseph, thank you. Just breathe. Thank you. Nani, thank you. Thank you everybody for joining us. Thank you. So subscribe our YouTube channel, and so that you can watch Vinod's after therapy live also. Okay, thank you everybody.